Welcome to this series on communication and consultation skills. Today we're going to look at the skill of shared management. Before we get into it, if you're not already subscribed to the channel, please do like this video, click subscribe so that you can get notified when the next video goes live next week. So, when you come to the management part of your consultation, you've done your data gathering, you've taken a history, if you've necessary, you've examined, you know what's going on, you've made a diagnosis. You've explained the diagnosis, and now you're coming to discuss management. How can you demonstrate the skill of shared management, which is part of the interpersonal skills of relating to others' domain, in terms of which being marked, but you demonstrate it when you're discussing the management, don't you? The first thing is to understand that you need to involve patients in decision making where it's appropriate. i.e., is there a decision that the patient can make where they can have some input where it would be appropriate to ask them? Well, if you ask the patient to make a choice between something that's fake, that you wouldn't do in real life, or it wouldn't be logical for the patient to be the one to make that decision, it's not going to work. The examiner is going to see through that. So let me give you an example. Let's say you've got a patient who's got dyspeptic symptoms, and from your history and examination, you've excluded any red flags. Doesn't look like there's anything serious causing this. It looks like it's reflux. And they've got some things in their lifestyle. They're a heavy smoker, and that could be perhaps one of the triggers for this reflux. Well, what would be appropriate in terms of the management is the guidelines suggest that there's not really any better or worse option in terms of whether they go for a PPI or testing and treating for H. pylori. So therefore, you could involve them in that decision. The research shows that, for a patient like you, where we've not found a serious cause of this, and it looks like it's reflux, and reflux is where we will have acid in our stomach. We need acid to digest our food, but sometimes that acid can travel up into the food pipe, and that can cause that burning pain you've described. But the ways that we could manage it for someone in your situation, one option would be we could try to give you a tablet that reduces and almost stops acid production in the stomach. Another option is we could test you for a type of stomach bug that some patients have, and sometimes that can be the cause of this. And if we find that it's there is a treatment which is a combination of 2 antibiotics and an anti-acid tablet. Did you have a preference? Or how do you feel about these two options? This is appropriate because the research suggests that one isn't better than the other, so involve the patient in that decision. Whereas someone that made the decision for the patient, I think you should try omeprazole for a month, and then I'll see you back in a month and we'll see how you get on. Do you agree? And they just ask that, do you agree at the end? And in their mind they think, well, I've asked them and they've said it's okay, so I've shared the management. That's not shared management at all. Can you see? That's false. It's going to come across as false. But equally, some doctors, because they're trying to tick an imaginary box that they've shared every choice, they will offer a patient a choice that's inappropriate. Like if the patient prefers to have a PPI, you decide whether you give them omeprazole or lansoprazole or rabeprazole or pantoprazole. Okay, that's a decision for a clinician. It would not be appropriate to say to a patient, right, there's a couple of choices here. One option is I could prescribe lansoprazole. Another option is I could prescribe omeprazole. Do you have a preference between these PPIs? Patient doesn't know what a PPI is. Do you see? That's an inappropriate and false choice to give to the patient. Okay, so that's important in terms of when you're sharing management. Make it truly a shared decision where it's appropriate. Don't offer inappropriate choices. Another example of when it would not be appropriate to give patients fake choices. If you've got a patient with crushing central chest pain, radiates to the jaw on the left side, they're clammy and sweaty, they've had this pain for a significant amount of time, and you think that they're in the process of having an acute coronary syndrome. Can you see? You need to get them an ambulance and get them into hospital as soon as possible. The sooner they get thrombolized, the more likely that they're going to have a good outcome, right? It's not appropriate here to make a fake choice. I think that this might be the startings of a heart attack. I've got a couple of choices here. One option is I could give you this aspirin, I could get an ambulance here as soon as possible so that we can get you treated. Another option is we could just see how you go for the next half an hour. The patient will be dead in half an hour. What are you talking about? That wouldn't make any sense, would it? That would be an inappropriate and a fake choice to give. It would be unsafe, and it's going to lead you to getting a fail in your data gathering and your management and probably your interpersonal, because this is an inappropriate use of this. You see? So it's really important that you're not trying to tick an imaginary box, but that where it is appropriate, you involve the patient in decision making as part of shared management. Hope that's helpful. If you found it helpful, do subscribe to the video, do like and share it with your colleagues, and I do hope to see you for the next one in the series.